All right, welcome. Thank you for joining us today. We're going to get started in just a couple of minutes while we let participants roll in. While we get started, we have a poll for you. Today's topic is relaxing COVID restrictions, how we're navigating risk as these restrictions are lifted. And we know that certainly we're all feeling that pressure to get back to normal. And so as we do, please go ahead and join us, answer some questions around which of these COVID restrictions are the most challenging for you as you start to kind of navigate these back to normal waters. We'll get started in just about 2 minutes, but in the meantime, please go ahead and respond to the poll while you're getting settled. Thank you.
And I would say all of them. Although it's the week
That's
of mass
unfair
questions.
since you came up with the categories, though.
It is the week of mass questions for sure.
Week, month, year.
Yeah.
Yeah.
It's a challenging
Decade,
week for mass.
maybe.
Yeah.
Welcome to those who are joining us. We are just going to get started in a couple of minutes once more folks join us. In the meantime, please go ahead and respond to this poll. Thank you to the 11 folks who've responded already. If you haven't, please go ahead and respond to this poll as COVID restrictions are relaxing, which are most challenging for you. We're asking this because that's the topic of this some of this conversation today, and so we'd love to know what's really up for you. What's the challenge, and how can we kind of help address it a little bit? So, thank you for joining us. We'll get started in just one more minute. It's still trickling in here, flooding in, depending on. Excellent. All right. So why don't we get started? We'll leave the poll up for one more minute, and why don't we go to the next slide, and I'll start some introductions. We'll get started. All right. Thank you to those who are just joining us. We're joined here today by 3 of our amazing panelists. First, we're joined by Roslyn Stone, founder of Zedic and the CEO of 0 Hour Health. Roslyn, would you like to introduce yourself, say a couple words, and then we'll introduce Kerry and Michael?
I will. I'm sorry. That was my mistake. There we go. Thank you, everyone. Good afternoon. My name is Roslyn Stone. I'm really pleased to join you all and that you've all joined us here today. I apologize for my slide issues. So we formed 0 Hour Health almost 30 years ago to be the medical department for companies that didn't have their own. And here we are today. We went into business being a company that did many flu shots as one of the services that we did in the restaurant industry, and grew to 30 years later being very much a medical crisis response and preparation business for all kinds of businesses. And here we are, gone full circle with flu. Today, we're going to talk about where we are now with COVID and how the relaxing restrictions are hopefully taking us to a new normal. But thank you all for joining us today. And joining us today also are Kerry Bridges and Michael Halen.
Excellent. Thank you. Yeah, so we're so excited to have Kerry and Mike here with us. Kerry is the Vice President of Food Safety at Chipotle, and Mike Halen is a Senior Restaurant Analyst with Bloomberg Intelligence. And so we were really interested, we know that this is the topic that is top of mind for pretty much everyone in almost every industry across every business right now, is these relaxing COVID restrictions, getting back to normal. What does that look like? And so we're super excited to have some different kind of perspectives today. So before we get started though, we know that there's a lot changing. There always is. And so we'd love to start with just a quick overview from you, Roslyn, about kind of where are we now? What's the COVID situation? We know that there's a lot of changes happening with vaccines and what fully vaccinated people can do. And so we'll start with just a quick overview there, and then we'll kind of dive into getting Kerry and Mike's point of view.
Thanks, Jen. Well, by the numbers, as you all know, we're seeing daily case counts drop. We are concerned that may be a bit artificial because we're also seeing daily testing drop precipitously and disproportionately to the daily case counts dropping. So although the positive rates are lower and the number of new cases and the number of daily deaths have dropped, yesterday was around 40,000, which was the best weekday we've had in months and months. Yesterday, there was also less than 25% of the testing that was done a month ago, 2 months ago, 3 months ago. So we are watching that carefully. We're also carefully watching, and as I'm sure you've heard, most of the hospitalizations that are taking place now are in younger people. And that's concerning. You know, we've learned a lot about how to treat COVID. We've learned a lot how to detect it and how to test for it earlier and quicker. But we are seeing younger hospitalizations and we're seeing pediatric hospitalizations. Spoke with a neonatal and a pediatric ICU director earlier in the week who said that they ran 2, 3, 4, 5 COVID patients in their ICU back at the height of the January surge and before that, and that currently their pediatric ICU is full with 40 patients. That's concerning. So, you know, overall, things are better. We think there's some seasonality to it being better, and that we would have seen some natural drop off, but we've also done a good job at least starting the vaccinations and getting something that isn't exactly herd immunity, but getting more people protected across the country. And they are major contributing factors, but there's also some seasonality that we're concerned about and concerned that we may see a cycle back in the fall. You know, we have flu season every fall into the winter, heading and tailing off in the spring. It's very possible we will see something similar with COVID because coronaviruses work in a very similar way. Vaccine rollout, as you indicated in the survey, is really a concern for everyone. We've seen it slow down really to a trickle in many places, and that's very, very concerning. And that's something that many of you are talking with us about on a daily basis. What we're seeing are that it was difficult to get appointments, and that was one of the impediments to vaccination early on, and that many of your employees had difficulty navigating the appointment system, couldn't go at the times that there were appointments, couldn't get an appointment, didn't have the ability to sit and hit refresh like many of us did till we got appointments. What we're seeing are no appointments needed rolling out. The president endorsed it yesterday and really made a big push for most of the major pharmacies offering no appointment vaccinations. And we think that's going to be absolutely incredibly effective in helping us get employees vaccinated across the country. We are seeing fewer work exclusions for close contact, and that's really good news. So people are in some ways getting the point about not having close contact and about isolating when they're sick. We're seeing fewer sick people, and therefore there are few people that are having close contact with them. But you are all seeing more rest of today exclusions in our system and your systems. And that's also good news because that's most likely vaccination side effects. Many of them are. Also contributing factor is allergy season. And we hopefully are getting towards the end of spring allergies in many parts of the country. And some of the rain in the Northeast today, I'll take some of the pollen out of the air and help in the Northeast. But again, we see rest of today's as a win, that it means that many of them are due to employees having mild vaccination reactions. By tomorrow, better, ready to go back to work. We're seeing different reactions in different portions of the employee population. It does anecdotally seem that younger people are having a bit more of a reaction to the vaccination. People who've had COVID have had more of a reaction to vaccination. Generally, our guidance is that it is a vaccination side effect if it happens within 48 hours of receiving the vaccination, and generally doesn't last more than 48 hours, in most instances less than 24. We have seen some incidents of people getting sick or coming down with COVID after they've been vaccinated because it's not yet, for the most part, 14 days after dose 2. And we're watching that closely, and that's sometimes a bit of a hard concept for employees and managers to understand. You know, there are certain things that we know are not part of COVID vaccinations, and that's any respiratory symptoms. So we're watching that closely. We're hearing more and more from you about employee fears, about COVID, about vaccinations, about public interactions. We're not sure how that's playing into the current staffing situation that all of our clients are experiencing across industries. But there's certainly a high level of fear among employees about COVID, about vaccinations, and about the risk of their positions. And we'll talk about this much further, but we're hearing an awful lot about difficulty navigating the new mask requirements and the changing mask requirements for both vaccinated and unvaccinated folks. And there's a new report out today about decreased mask usage in both of those groups, and that's concerning because the changes in mask requirements were really only aimed at vaccinated individuals, and yet we're seeing decreased mask usage in those who are unvaccinated. So we need to keep an eye on that and keep that in the forefront, that masking, social distancing are still part of the norm. So that's where we are today, better than where we were a month ago, no question about it, but in a new and different place. And again, from the people that responded to the survey, you certainly are saying that mask requirements are the top issue that many of you are dealing with, and particularly with regard to guests and customers.
Absolutely. I was just sharing the polls so that you could touch on that. I think it's really interesting. About 61% of people that responded as we were coming in are saying that guest masks are a big issue for them, as is navigating local and state requirements, which might tie really closely into the masking issue, right? So as these restrictions relax, it's a tough path to navigate. Excellent. Well, thank you so much, Roslyn. Really appreciate it. What we want to do now is actually, so this is kind of our quick overview of where are we in the scene in the world of COVID, what's going on. But we also know that there is a path forward, and so we're super excited to kind of kick it over to Kerry Bridges. Kerry is works at Chipotle, works in food safety at Chipotle, and is a longtime friend of Zero Hour Health. So Kerry, thank you so much for being here.
Yeah, thanks so much. I'm sorry, Jen.
No, go ahead. I was just going to say, do you want to kind of take 2 seconds to introduce yourself?
Sure.
And then we'll ask you to kind of dive into kind of what was your kind of biggest learning around the world of pre and post COVID, and how are you thinking about navigating as we start to relax these restrictions?
Yeah, thanks, Jen. So as Jen shared, I oversee food safety at Chipotle, and I've been with Chipotle for a couple of years. Prior to that, I was overseeing supplier food safety with Walmart. But yeah, I think we've worked closely with Zero Hour Health for a number of years. I think dates back to prior to my time joining the company. I think 2007, if that's right, Roslyn. So a long time ago. Maybe you were 12 at the time, but. I think just the opportunity to share, I think today is a lot of the work that we had put in to, mitigate the risk of foodborne illness proved to be very effective and set us up for success as we navigated through COVID-19. So, in a lot of these things that we done prior to COVID-19, obviously we'll continue to do as we return to, normal. And, I'll list out a few of those things. Air purification was one that we took on. I think 2016, we put RGF into every single one of our restaurants, both in the restaurants, also in the restrooms. And we were already using effective sanitizers. So we used Purell, both on food contact surface, and also a part of our hand washing protocol is that we follow hand washing with hand sanitizer. And then daily wellness checks. I mean, those were huge and something that we have done for several years. And we've got HACCP built into every single one of our restaurants. And wellness checks are CCP #1. So we take them very seriously, actually have zero tolerance around them. So if you don't complete a wellness check, then unfortunately you are terminated. So, those wellness checks have always been around foodborne illness, but with COVID, we expanded those and included symptoms of COVID-19. And for anyone who alleges to have those symptoms, our process has always been and continues to be that we triage you through our clinical team through Zero Hour Health. And usually that's not caught, during a wellness check. It's usually an employee that's calling in from home, but still it's a very defined process. And working with that clinical team, then we do exclude the appropriate number of days with the employee. And with that, we get great visibility across, all 2,800 of our restaurants. We know at any given location at any given time how many exclusions we have in that restaurant. And it was, throughout COVID, we also had our BI team, which was mapping cases across the country. And we could see, okay, where are our trends as it relates to hotspots across the country? So it was very valuable insight for us to have. And anytime we felt like there might be more than 2 employees that could be alleging to have symptoms, we had our neuro prevention protocol very well established. All of our employees are trained to this. And so it wasn't new for them. And really the message was continue to do what you've been trained to do. And that made our lives a lot easier, because while there was some new absolutely introduced into the restaurants, whether that was masks or physical distancing, a lot of our protocols to ensure employee and guest health and safety were already well established and baked into the restaurant. So again, that just really set us up for success. And just on, continuing to do what you've been doing on that same thought, the same applied for our food safety audit. So all of our third-party audits continued to happen just as much as our food safety checks from our field leadership or general managers in the restaurants. We know anytime the business is under any kind of pressure, now is not to take the foot off the gas, and we continue with the food safety checks that we've had, and we never did, pause. And then the thought on returning to normal, I think the message there is that we're gonna take our time. And anytime we think about dialing back on a protocol, there's a lot of boxes to check. And is it, are we in compliance with CDC guidance? Is it, are we in compliance with OSHA or the state or local health department requirements? And a big piece of that is also understanding the employee and guest sentiment. So we always have to consider that. And I'll give an example of that. We rolled out thermometers to all 2,800 of our restaurants. And it wasn't because the science supported that anyone with COVID would present with symptoms of a fever. We knew that wasn't the case. And also, that combined with, the use of fever reducing medication, that fevers wouldn't always be present during a wellness check. But we heard it loud and clear from our surveys with our employees that it was something that made them feel safe. And so we gave thermometers to everybody. And we wouldn't consider to dial that back or no longer offer thermometers if that was something that continued to make our employees feel really safe. And so in the same with, guests, it's, we really have great visibility now that the digital experience is something that our customers want to see more of. So the business will continue to invest in that. But yeah, I think the message is a lot of what we've done prior to COVID we'll continue to do when it comes to keeping the priority of the health and safety of our employees. So with that, I'll turn it over to Mike, and I really look forward to the Q&A portion of the webinar.
Thank you.
Excellent. Thank you so much, Kerry. Yeah, and so we are super excited to kind of take this from the world of what Chipotle has done to prepare, that made them really ready. And then some of the stuff that you're talking about at the end, Kerry, I think is a beautiful transition into Mike Halen's work. And so Mike is a senior restaurant analyst at Bloomberg Intelligence. And we'll talk a little bit about kind of what that new normal might look like on a maybe on a larger scale. So Mike, we'd love to hear a little bit from you about what's happening out there. What are the trends that we're seeing? What are you expecting in terms of what the next few months of kind of relaxing COVID restrictions could look like?
Yeah, hopefully I have more answers for you than I have questions of my own, but let's just jump right in. So we're gonna just cover a few topics, sales, how everybody's doing in April, known unknowns, trends, and the first quarter earnings call notes. So, myself and my team, we cover 19 publicly traded restaurants. Most of the big companies, including, Chipotle and Darden and McDonald's, and we write research on the names and try to project out earnings, and we communicate our findings to institutional investors, hedge funds, mutual funds, stuff like that. So sales are booming. It's great to see. QSR 2-year same-store sales are up 20% in March. They had been running up about 10% since September. We think they got a nice boost, obviously, from the drive-throughs and their delivery business. And then stimulus has been helping, right? Stimulus gave them a nice boost in January. February hurt everybody because of the weather. And then March was very strong with the stimulus checks being dispersed. And then it's really nice to see the huge comeback in full service, right? The casual dining chains that we cover have seen a ton of pent-up demand as people are becoming more widely vaccinated. They're getting a boost from stimulus as well as easing of dining room restrictions. So stimulus has been interesting. It looks like stimulus impact may be greater than we initially thought. We wrote some research. Based on what we saw last April and January, we thought it would be about 5% and last about 5 to 7 weeks. 5 weeks for full service and maybe 7 weeks for for the quick service names, but that may be pushed up. So then, the timeline could be a little bit shorter because it seems like the stimulus spending has been pretty aggressive. We won't know for sure, probably for another couple months, but the results at the casual dining chains have been phenomenal. Cheesecake is running 7% higher than they did in 2019 in April. Chili's is up 10% from April 2019. They're getting a nice boost from their It's Just Wings virtual brand. Bloomin', as well as their biggest brand Outback were both up 13% in April, and Texas Roadhouse continues to knock the cover off the ball. Their same-store sales jumped 21%.
Wow.
Over April last year. So it's absolutely great to see a lot of these franchisees and casual dining chains we cover, entrepreneurs and small mom and pop shops. Everybody has needed this. It's been a tough year, so it's absolutely been great to see, and hopefully most of these sales can be sustained moving forward. That being said, there's still a lot of unknown variables, and I know my job is to try to predict the future, but I feel like I'm smart enough to know when I don't know something. So there's some things that still we have questions about. Pent-up demand is number one. How long does it last? What does it look like geographically, right? I'd assume pent-up demand is probably stronger right now in some of the places that have had fewer restrictions, whereas pent-up demand in New York and New Jersey and California may hit harder in May than it did in April, right? Is eating at home a habit that has been ingrained, right? It takes 66 days to create a new habit, and a lot of new habits were picked up, and people, I'm sure, have expanded their culinary skills a bit. At the same time, right now, everyone's sick of cooking for themselves, and they want to interact with some other people and sit down and have a drink, outside. So we're going to see, though, if eating at home can maybe take back some share from eating away from home. Delivery and to go are most definitely going to be sticky, and they're definitely going to level out higher than they were in 2019. There's no doubt about that. But how high once dining rooms fully open? Is it going to be 20%? Is it going to be 25%? Maybe even 30% for some? And how much of that business cannibalizes their dining room, or is it, and what percentage of it is incremental? And then how does that impact margins, right? Because, obviously, delivery margins aren't great because you have higher paper and packaging. You have to pay delivery fees if you're using third-party aggregators. And then on top of it, you have fewer high margin drink sales. So something we're keeping a close eye on. 10% of independents seem to have closed, right? So that was from Cisco yesterday. Those numbers are lower than many expected. So that's still going to be a tailwind for the casual dining chains we cover. We don't know how long that's going to be. We don't know how many of that 10% is going to reopen. I'm sure there's many entrepreneurs that shut down right away and then now are either have reopened or have plans to reopen, or going to reopen whenever they feel the coast is clear. So we don't know how long that tailwind is going to last. The fifth one, this is probably the biggest, is the economy. What does it look like 6 months from now? I don't know if anyone knows what it's going to look like once the stimulus wears off in the next month or two. Also, what happens when rent and mortgage moratoriums end? There's 8 million renters in the U.S. behind an average of $5,600. So, that could weigh later on this year, but we don't really know what the timeline is going to be there. And then finally, how persistent is inflation? This is something that everybody's talking about right now. In the restaurant industry, we're seeing corn, wheat, chicken wings shortening, and of course, gasoline, which is used to ship that stuff all over the country. And then, of course, labor. All of these right now are a hot topic. The Fed claims it's transitory. Other people like Warren Buffett don't agree. So we'll see. So despite all those questions and the fact that no one really has the answers, we've seen some of the highest valuations ever in the restaurant space. All right, so next I'll just go quickly over trends. The one big one I think everyone's aware is tech adoption. Tech adoption has really accelerated. Some examples we have, Starbucks, who's been a leader, I'd say, with Domino's, for years now. Starbucks is now using their AI platform known as Deep Brew to help them with daily inventory buys at the store level, GM scheduling at the store level, and they're even doing predictive analysis on vaccination progress in different areas of the country. So, so they continue to lead the pack, in our opinion. Yum Brands, who was behind some of their quick service peers, bought 2 tech companies over the last quarter, over the last quarter or two, one for AI driven marketing, and then another one for frictionless ordering through text and social media and stuff like that. So that was an interesting move. And then Chipotle made headlines with their investment in Nuro. For those who aren't familiar, that's the autonomous delivery vehicle company. Domino's also invested in them, and they're already actually delivering some pizzas in Houston right now. And then finally, loyalty programs are being rolled out at many of the quick service chains, which, are kind of lagging on that front: McDonald's, Wendy's, and Burger King. And it's going to be important because you don't want to end up like a Tim Hortons where, you end up just giving free stuff to people that were going to come to your restaurant anyway and end up hurting margins and not really boosting your sales. So it's going to be important. Execution is going to be very important for those chains. And then chicken's still hot. Right. Burger King's using some of its learnings from the Popeyes chicken sandwich to do their own hand breaded sandwich. And we'll see how that does. And then McDonald's, 1,418, the 800-pound gorilla, they got 14,000 stores in the United States. And they're coming out with their own chicken sandwich, and trying to get a piece of that business. And if they do a good job, usually what's good for McDonald's is kind of rough for everybody else in the quick service business just because of their size. And then just quick 2 earnings comments of notes, because I had a busy week last week listening to all these earnings calls and writing research. So I figured I'd share a couple of the more important tidbits. The first one's McDonald's. McDonald's is testing self-delivery in some markets. So we've been writing for a long time that Domino's and Papa John's and those chains that do self-delivery and more recently Bloomin', we've been writing that that's a big competitive advantage. And so, a lot of these chains that we covered jumped in with third-party operators because they wanted to get into delivery quickly and they were kind of behind. So now that you see McDonald's maybe testing self-delivery, I think we could see some other chains starting to do the same. And this could actually pressure third-party delivery companies to maybe charge a little bit less, but we'll see. And then they also mentioned that they said they could possibly make the argument that stimulus checks are wearing off. And then with Texas Roadhouse, it was another interesting call. They spoke a lot about the labor market and labor inflation, and they said they were really forced to increase wages to attract employees. Lots of applicants still aren't showing up for interviews. They're increasing menu prices to offset this, and the fact that their traffic has been so strong for the last decade, I think they, more than anyone else in that we cover in casual dining, has room to increase menu prices to offset it. And they also mentioned that luckily for them, turnover was very low compared to historical levels.
Excellent.
Fabulous. Super, super interesting stuff. Really, really appreciate it. And also makes me want a chicken sandwich now. Fabulous. Thank you so much. We have lots of questions, and we really want to use the whole rest of our time, most of the next 33 minutes or so, to get to your questions. So if you are a participant, please drop your questions into the Q&A section, and we will ask them live. If you've already submitted some questions beforehand, and we have lots and lots of really good questions beforehand, we'll do our best to get to all of them. But I guess to start us off, while it's still fresh in our minds, Michael, we have one for you that is coming around specifically what you talked about around those third-party deliveries. And so the question is, how does the increase of top-line revenue affect the bottom line, considering the cost of those third-party distributions? And does the self-delivery impact that in any way?
Yeah, so the cost is typically between 15 and 25%, maybe even 30% for restaurateurs that own one unit. A lot of the third-party operators have been which is basically very difficult for anyone to make money. It's the third party delivery companies haven't made money. The restaurant chains haven't made money off that. They have begun to allow the chains to increase, menu prices for the delivered orders. And there's been a wide acceptance of that over the last 12 months. The question is going to be, moving forward, are people going to accept, a food item that almost costs double what it would cost if you went through the drive-through, right? So, right now, there is some money flowing through without a doubt on these delivery orders because of those price increases. The way we look at it is chains like Chipotle and chains like Texas Roadhouse that have very loyal customer bases that are generating strong traffic gains, that have a history of strong traffic gains leading into the pandemic, are going to be the ones that are able to charge a little bit more and have better revenues and better profits on the, more money hitting the bottom line.
Great. Thank you very much. Appreciate that. Excellent. So we have a lot of questions from all over the board. Relaxing COVID restrictions and what the future looks like is hitting everything from vaccination to clinical questions to lots of questions about state and local guidelines. One of our first hot topics for pre-submitted questions is around, what is the actual experience going to look like in a business, in a restaurant, in terms of employees. So a question we got probably 10 different ways is, will our employees need to be wearing masks and social distancing in the future, especially if some of them or many of them are getting fully vaccinated? So I'm curious, Kerry or Roslyn, does one of you want to take a crack at this question?
Kerry, why don't you take it first and then I'll follow up.
Okay. Yeah, Jen, I think right now, since we're in this environment of you've got a mix of fully vaccinated and unvaccinated, like that restaurant experience is still gonna, there's still masks in the picture. I think that question of when masks are not, going to be a part of indoor dining, I don't have a crystal ball, nor, I think the point that I made earlier is like, to be very slow and considerate about dialing back any of these protocols. But yeah, I think like in the immediate future, I don't envision that employee masks are going to go away. But I'll turn it to you, Roslyn, to add any context to that.
I would agree with that. Again, we're seeing a relatively slow uptake of vaccination across employee populations across the workforce. We've all seen our support centers and our executive leadership teams and the like get vaccinated, at a very high level. We haven't seen that kind of uptake in the 18 to 49 population across the country. And that's the majority of our workforce. So until that happens, and until we see really dropped off COVID numbers, I do think that masks in an indoor situation are going to be the norm. They may also be, back to something I said earlier, they may be a seasonal norm. And we may have times of the year that we're unmasked. And fortunately, it will be in the summer. We have very hot kitchens. We have very hot workplaces. And so that if it turns out that we're unmasked in the summer and more masked in the winter, that may be part of what the norm looks like. And, in other parts of the world, that's what it looks like, or masking is just the norm. So it's uncomfortable to go over a fryer when you're masked.
Or grill, yeah.
Or grill, yeah.
Absolutely. Excellent. Thank you both. Along those kind of same lines, about or around the idea of vaccination, I guess. So still in the realm of, telling vaccinated and unvaccinated people apart. What's and Roslyn, I think this, or Kerry, actually, this could easily be for both of you. Is mandating vaccines something that owners or operators could actually do viably? And it's something that they should be considering, especially as we're hearing the information you shared, Roslyn, around this low uptake in vaccination, right? That I read yesterday that LA had 20,000 fewer appointments for vaccinations this week than they did last week, right? As we hear those things about vaccinations dropping, is mandated vaccine something that we should be giving a little more weight to as we approach? And Kerry, I see you nodding your head. You want to take a crack at that?
Yeah, sure. I think, our role right now and how we've, managed through vaccinations is we look at this as an opportunity to encourage, educate as much as try and track vaccine records. So what we've tried to do with the field is just give a lot of forums, just like you're doing today, of an opportunity to ask questions to the field and helping them understand the science and, really behind the safety and effectiveness of vaccines. And we've also done some, testimonials of employees in the field and their experience being vaccinated. And, I think end of the day, it's a personal choice, but still we feel like it's, an opportunity for us, again, to encourage and educate. And even for vaccine records right now for the, the cards, we have a place to upload those in our internal systems. But again, it's optional. But it is something that the clinical team is asking if there is any, symptoms or an employee that alleges to be exposed. The clinical team will also ask those questions and say, hey, are you fully vaccinated? And does that play a part in your exclusion?
Right. We can't answer the legal question as to whether or not you can mandate vaccination. That's something that needs to be discussed with counsel. And we never, ever want to see any one of our clients have a test case. And I would guess that a vaccine mandatory requirement might go all the way to the Supreme Court. But with that said, there are lots of ways to encourage vaccination and to let employees know the advantages to being vaccinated, that we care about them. We care about the risks that they face interacting with the public, whether we're talking about a restaurant or an industrial laundry plant, or, we support a lot of telecom workers, that they're all interacting in settings that could, that carry some level of risk. And although the risk is lower than it was a month ago or 2 months ago, again, we're seeing these cycles. So we are encouraging vaccinations, supporting it, showing, being first in line and putting out those kinds of videos. We have clients that are doing incentives. They're not necessarily seeing much higher participation than those who are not. That's very interesting, because that will affect their bottom line, and the bottom line that Mike was talking about. Incentives are not cheap. There are a couple of states that are requiring that you compensate employees to get vaccinated. We do see something new that's really, really helpful, and we've trialed over the last couple of weeks. It's really been very helpful. And again, that's that navigating the appointment system has been challenging, helping your employees, encouraging them, saying, here's where the pop-up is today that doesn't need appointments. Do you want to go during your shift, or, can I get you off an hour early so you can go? Those are ways to help employees get vaccinated without, mandating it, without coercion.
Great. Thank you both for that. Really appreciate it. All right. We have a lot of questions coming in the live Q&A around ghost kitchens. So we're pivoting over to the ghost kitchen world. We have a couple of different questions around this. One, is that, someone's commenting that they saw that Chipotle is selling to-go only menu items, or digital only menu items.
Love those quesadillas.
I was going to say that quesadilla is really next level. As a strong quesadilla fan, really a big fan. Questions around, is Chipotle planning on using ghost kitchens? And some more for Michael. Can you speak to what kind of market insights about ghost kitchens? And then another related question is, should we be concerned that Walmart is entering the ghost kitchen space? You mentioned what's good for McDonald's tends to be bad for other QSR. Is the same true of Walmart? So Kerry, why don't we start with you on Chipotle scale, and then we'll kick it over to Michael to talk kind of more broadly about the market insights around ghost kitchens.
Yeah, Jen, I think it's a good question, right? And there may be thoughts and insights to Chipotle that I'm not privy to for sure, but it is, we do have a similar concept in the UK, not in the US right now. We have explored like the digital only menu items, like we're nodding our heads to quesadillas. They're phenomenal and amazing. And if you haven't tried one, you should. But, I think nothing's off the table. I think we'll continue to explore like similar concepts, but that's really all that I can speak to right now. So I'll turn it over to you, Mike.
Sure. So ghost kitchens, have been hot heading into the pandemic, and now they're, hotter than ever. They're popping up everywhere. Places like Kitchen United are expanding very fast, and a big part of that is, I guess one of the unknown unknowns that I kind of skipped over was real estate, right? And telecommuting, and what the level of telecommuting is going to look like in 2022 and beyond, right? And so, we think a lot more people are going to be working from home, if not all the time, more often. So what does that do to real estate and corporate centers, right? It kind of hurts them, but it should help suburban area sales, right? And so that's where these ghost kitchens come in, and there's a lot of different uses, right? Like, chains can, I think a popular one is chains that have strong traffic are using this as a way to kind of ease some kitchen ease like some of the stress on the kitchen, get some of those delivery guys out of your lobby and kind of just, get back to normal operations in your regular restaurants. I mean, you're also seeing chains experiment with different brands in some of these ghost kitchens, right? Because it's a very low risk way to see if, a new menu or a new menu item might work, right? So, with suburban sales, since they've been so strong over the last year, and we expect them to continue to be strong, I think, the excitement over ghost kitchens isn't going away. I think they're gonna be, a big part of the restaurant industry moving forward.
Yeah. Hey, Jen, one more thing I'll add for Chipotle. We don't have the ghost kitchens, like I said, but we do have digital make lines. And so just what Mike was saying kind of prompted me to think of, it is kind of our ghost kitchen within our kitchen, of saying like, how do we support all the digital orders coming in? Because it's a completely separate second line than our main make line.
And just to follow up on that, the second make line is a really good example of that. All of the food safety and pre-COVID practices that Chipotle had in place applied to that second make line and made them prepared to pick up those digital sales while maintaining all their COVID protocols, and can modify them going forward relatively easily because they're just within the same
Right.
footprint.
Excellent. Thank you all for that. It's such an interesting part. We have a switching, I'm kind of just bopping back and forth here between clinical and market insights and all of that, but we have a bunch of questions around all of the various guidelines that restaurants need to follow. So I've been asked this question in probably 5 different ways, but this is the best way I can come up with to kind of consolidate those questions, which is, around something like a mask mandate or capacity limit, something like that. An individual operator is dealing with local, sometimes city, county, state, sometimes state and governor, CDC and OSHA guidelines. Which ones should they use? I think that's the best way to ask this question. And kind of how are you navigating that, or how are you seeing places navigate that well? And Cal OSHA.
Yeah, I know. There are a lot.
I missed one other layer in the parfait of guidelines.
Right. Yeah. And I think that's the benefit. I think I mentioned we have a COVID task force internally where it's, it's our ops, legal, people experience, benefits, my food safety team. And we meet twice a week and just talk about all the various things that could be hitting the restaurant at any given time. And it's hard to say which one's more important than the other. I don't think I'd go there, but I think the important thing is that you are complying. And on the masks one, it's like we've not dialed back on masks for guests or for employees, and we're not, mask police out there in the restaurants for sure. Like the goal is to serve people as quickly as possible, but at the same time, this goes back to the point I've made a couple of times of being very slow and mindful of how you dial back and where, because there are so many of these varying guidance and sometimes conflicting each other that you just want to make sure that you're checking all those boxes.
We had hoped, our heads were spinning a year ago with all the regulations changing every day, sometimes multiple times a day, and keeping track of what new state regs were coming down and what a county was doing. Miami was a great example where we had, the state of Florida, we had Dade County, and then we had Miami Beach that all had conflicting regulations. We had several clients that had restaurants closed or businesses closed because they weren't following the local guidance, but they were following the county guidance and the state guidance. We had really expected to see that slow down a lot more than it has. again, not necessarily daily like it was then, but we're still getting conflicting guidance every day. The biggest one that we have right now, is that the CDC has changed the exclusion guidance that if you're fully vaccinated, that you don't need to be excluded for close contact. OSHA has not adopted that. And that is a very, very large issue across business, and particularly across the restaurant industry right now, since the restaurant industry is clearly, OSHA has stated that the restaurant industry will be a focus in the next, period of time. So there's no easy answer to that. And it takes a village, similar to what Kerry just described, and the village has to be active. It's kind of cool that you were able to, I don't remember when we dialed back, or you dialed back to twice a week. There were periods of time that it was twice a day. So I guess that's progress.
Yeah, no, we started out 7 days a week, and we just this past couple weeks went down to twice a week. But yes, it's been, a lot. The other thing I would just call out is how important it is to kind of document all of these protocols, and because just like Roslyn was saying, you never can rule out that there could be another surge in an area or hotspot where these mandates then are coming back into effect. So just as quickly as you're dialing back, you may need to know how to put those back into place quickly. So our ops team has done a really good job kind of documenting what it takes to dial them back and what are those triggers. At the same time, how can we quickly put them in place in the event that we need to?
Sure. And Oregon is a good example of that, where Oregon just went back to higher restrictions. And parts of
Absolutely. Absolutely. Great. Thank you. Yeah, fascinating stuff, and a really interesting point that this isn't going to be, a smooth curve down. It's going to be bumps in the road. There are going to be individual outbreaks. There's going to be hot spots. And we're seeing that across all of our client base, and across the whole world. Right. And there's just so many variables too that we haven't touched on, like boosters, right? Like, booster vaccination and variants and all that stuff. And so, as we think about those variables, we actually have two interesting questions that I haven't seen before, which I think could be either for Kerry or for Michael. But this is around the idea of insurance. Some folks are asking about pandemic insurance. Is it something that they should be considering in the future? Is it something that's worked well? So I'm curious if either of you have thoughts around whether, restaurants or other business operators should be thinking about pandemic insurance in the future. Obviously, I'm sure I am not an expert in insurance, but I imagine it's slightly more expensive now than it was in 2019.
I'll let you take that one, Mike.
I was afraid you were going to say that. No, to be honest, I'm not too aware. I know some insurance contracts had pandemic clauses and stuff like that, but I'm unaware about how successful some of these chains were in terms of actually recouping any of that money from the insurance companies, to be honest.
We have several clients that are pursuing those. Pandemic insurance, pandemic insurance doesn't exist in, under that title, and most of the basic insurance plans don't, specifically exclude pandemics. We have a number of clients that are pursuing their business interruption insurance and claims that all of which were denied. We don't know that anyone has been successful in that we're aware of in them, but we have several very large clients that are pursuing those cases, because we're talking about a lot of money.
Oh yeah, absolutely. Thank you. That's an interesting one. I hadn't really heard about it. Maybe because it's business interruption insurance. There you go. All right. So switching gears a little bit back towards the clinical here. That we have a lot of different varieties of this question. And another one just came in through the live Q&A, which is how long do we have to keep doing employee daily wellness checks or health checks for? These could go by symptom surveys, daily wellness checks, health checks, whatever, any other name. But how long do we have to keep doing that for? And is there any way that we should be modifying that moving into the future? Yeah, I think that's the first part of the question. So Kerry, you want to take that one?
Yeah, I mean, I think for us, like I pointed out, it's these wellness checks were here for us prior to the pandemic, and they've been very successful and have helped us navigate through COVID. So we have no intention of dialing those back. Whether or not the symptoms within the wellness check change, that's another thing, but we will continue to keep these wellness checks because it's that important to ensure that you've got healthy employees working in the restaurants, and it's a great tool and we'll continue to use it.
I just have one thing to add. We saw a lot of illnesses go away during the first 8 months of COVID. Before COVID, roughly 58% of the incidents that we dealt with were something like norovirus, either confirmed noro or noro-like. And then, many of you are aware that we were as a nation dealing with a hepatitis A outbreak, which was artificially impacting the restaurant industry. And I say that because we don't, there really isn't a track record of hepatitis A being passed, although it can be a foodborne illness. There wasn't really a track record of it being passed in a food service setting. However, many local health departments respond to a single case and require employee vaccination, go public on hepatitis A case that can destroy a restaurant, can destroy a brand. Years ago, Chi-Chi's had their incident that destroyed, that have foodborne illness destroy their brand. So we think that the questions will change a little bit to address some of those issues. And we're asking a lot of questions about the frequent vomiting is a symptom of of COVID, but not in the same way as norovirus. We most likely will recommend that our wellness checks add one question that would identify hepatitis A as part of ongoing wellness checks.
Great, thank you. Along those same lines, as we're talking about relaxing restrictions, so we're talking about, when could or how could we potentially relax wellness checks? Sounds like the answer is don't do it. What about, masks when people are fully vaccinated? So, we're getting lots of questions like if the whole team, if an entire restaurant or an entire back of house or an entire group at headquarters, an entire team is fully vaccinated, do they still have to wear masks together? And Roslyn, I'm curious if you could speak a little bit to the answer to that. If a certain group is fully vaccinated, will they need to wear masks when they're together?
Well, that's a good question. And the answer appears to be that we're heading away from that being necessary, that we're heading towards it being okay for fully vaccinated people in smaller groups to be unmasked. The CDC has still pointed to unvaccinated people being from the same household or two households and not opening up the risk much beyond that. But with that said, we believe that the new normal will be that small groups who are vaccinated can meet without masks. We hope that the guidance will catch up with that, and we believe it will very quickly. With that said, the unfortunate part is many of our clients only at this point have documentation of 2 to 3% of their employee populations being fully vaccinated. We know that will change a lot over the next few weeks because there are lots of people that just got their first doses. Keep in mind, from becoming eligible to getting a 2-dose vaccine series is roughly 8 weeks, because it may take up to 2 weeks to get the shot, first shot, second shot, 4 weeks later, and 2 weeks after that till you're fully vaccinated. So we'll hopefully start to see bigger numbers. But unfortunately, that is a future issue, or an issue only for corporate teams, leadership teams, and the like at the moment. With the back of the house, front of house, that question came up several times yesterday for us. The problem that we have with separating back of house and front of house for different standards are that they mingle, both socially and that a server may go to the back of the house to grab something, or that a busser goes both in both sides of the house, and what happens there. So it's a bit complicated also when you're not really necessarily identifying, and nor can you publicly identify, Joni's been vaccinated, but Johnny has not, because that is a privacy issue that we do need to maintain. So the answer is it's complicated. It's going to change, and what that looks like and the new normal for that is yet to be determined.
Great. Last one in this line of questioning about, which things when we can give it up. Hygiene, theatrical cleaning, cleaning for the sake of cleaning. And Kerry, this really came to me when you talked about guest sentiment, employee and guest sentiment, when you were speaking a little bit. What's your take on do we need to keep up the kind of hygiene theater, knowing what we know about the fact that COVID really doesn't live very long on surfaces, and that it's primarily passed, through respiratory droplets and through person-to-person contact. What does that look like? How are you balancing guest sentiment, employee sentiment, and the actual science?
Yeah, no, it's a good question. And I think, for us, I mentioned our robust neuro prevention protocols. And so in those situations where we feel like, okay, there's multiple alleged symptoms or something happening in a specific region, or, through Roslyn's app, like we can see that norovirus is in the community, and just an abundance of caution, we want to take extra measures. And so a lot of our norovirus prevention protocols do include those things that you're speaking to, Jen, like the increased sanitizing of high touch surfaces, the increased hand washing. And some of that is now the norm. So the increased hand washing, even though we're already washing our hands between tasks and top of the hour and everything else, we've also have a 30-minute hand washing. That's a part of our, protocols right now. So whether or not that stays forever, I think it's one of those protocols that we'll continue to watch and understand, like, is this, somewhere where we feel comfortable dialing back? But I think for us, it's like, we're always going to err on the side of caution and continue to sanitize at increased frequency. And, when and where we need to increase on top of that, we absolutely will. And we do that today. And we've done that prior to the pandemic.
What we're hearing from guests is that cleanliness in restaurants, in all businesses, are far more important to them today. It was always important to them, but it's far more important to them today. I think that we will see some dialing back of the theatrical cleaning. I don't know that it will be necessary for there to be someone with a spray bottle in in every dining room all the time, which is what guests really have told us they want to see, recently. But with that said, there is an expectation, a very clear expectation, for clean businesses, and particularly clean bathrooms. Right. And guests, the quickest way to get a bad Yelp review, the quickest way to get a guest complaint, is when a bathroom isn't clean, or that or that your business is messy, is messy or dirty. So
yeah.
The CDC has been pretty clear in saying that theatrical sanitation is not necessary, but that isn't necessarily what our employees want to see, or certainly not what our guests want to see at this point.
Yeah. And still effective for norovirus and other things, I think I would include. But, and Roslyn said something that reminded me that, there was a time when we understood like how important it was to communicate all the protocols that we had done for COVID, even though, as I've shared throughout today, it's something we were already doing. But suddenly it was so important that was communicated directly to our guests. And so partnering with our, marketing team, we had inserts in all of our to-go orders just to communicate, look, this is everything that we're doing, because we heard loud and clear, like, your guests want to understand everything that you're doing. So we had a big effort to make sure that was communicated. I think it's on our website too.
Great. Yeah, absolutely. Yeah, so that kind of understanding what guests want and giving it to them is something that is really relevant. I think, Mike, this question is probably for you, is more broadly, you talked a little bit about what we're seeing in these trends for the future. Is there one thing that you could point to that the restaurants who are performing best right now are really doing in this weird transitional time, as we see COVID restrictions start to get lifted? Is there one thing you could point to that you say, the folks who are really successful are doing this thing?
I mean, if I'd say, I guess there's two ways to look at it. Number one, the companies that are doing really well, were doing really well heading into the pandemic and had loyal customer bases that love the brand. So, I mentioned already, Chipotle, Texas Roadhouse, Domino's, those chains, did really well heading into the pandemic. And, it was no surprise that Chipotle and Domino's did well. It was a little bit of a surprise that Texas Roadhouse did, because I think to-go was maybe 6% of sales, if that, and it was kind of an afterthought. So what they've been able to do with curbside to go has been amazing. But I'd say the one thing was really everyone to try to catch up on to go. Heading off the marketing marketing to your in-store experience and marketing towards takeout and delivery. Chipotle was one that offered free delivery or heavily discounted delivery. you know, a lot of the chains we cover, you know, Chili's being one of them, you know, Cheesecake Factory expanded their delivery services with additional third-party operators. I mean, you know, to get to where these chains are and doing really well in April, digital and delivery and to go has been absolutely massive for all of them.
Great, thank you. Thank you. All right, well, we're in our last couple of minutes. Any last thoughts from our panelists? Any last things you want to make sure that we get to? And if not, we could.
I had one thing. Emily Weigel. Emily Weigel from Red Robin asked a really good question in the chat, which is, could we get to a place where we have protocols for COVID only during community outbreaks at a certain percentage, otherwise you can operate normally? And that's a really interesting question. And the answer is we hope so. And Kerry pointed to documenting procedures for how you scale up to the higher precautions, and then dial up, dial down. I think that that's a really good question, a really good point, and likely that's where we hope that we're headed.
Excellent. Great. Thank you so much. Great. So I think we've got one last question. Maybe we can squeeze it right in the last minute, which is, have we heard anything about OSHA COVID inspections? And if we squeeze that in, then we'll go ahead and wrap up right after that.
I mean, I could just, I mean, we're watching and kind of waiting to see what else. I mean, obviously there's, you know, a lot of already OSHA activity in California and certain states across the country, but I also know that there's a lot coming down the pipeline. And so we're just continuing to watch to understand what is going to be communicated. But I don't know, Roslyn, if you have any further insight.
No, and we did a little bit of surveying across our client base over the last few days. One client had noticed an uptick in employee complaints to OSHA. The employee complaint, and everybody has had some level of employee OSHA complaints across the industry, across all industries, and they're generally surrounding workplace exposures. They're surrounding social distancing. They're surrounding masks. The same issues that we sort of talked about in the survey at the top. But we have seen them sort of level off, or not disappear, but level off to a new normal that's a little bit lower level. But we do fully expect to hear more from OSHA. They've very clearly stated it, and we'll be watching it closely.
Great. Thank you so much. Thanks to everyone for joining us. Kerry, Mike, thank you both so much for being here. We had a ton of great questions. And we know that this will continue to come up. So again, thank you both so much. Roslyn, thank you for being our fearless leader. And we are so appreciative. For those who are still watching, we'll send out a recording of this in the next couple of days. And we do this every month. So we will see you back here in June, marking almost a year and a half. Thank you so much.
Thank you.
Have a lovely rest of the day.
Thank you.
Thank you.
Thanks. Bye-bye.